For this video on the brain injury recovery guide, we are going to be talking about moving right, such as exercise and things like that. So no matter how you suffered your brain injury, concussion, more severe TBI, stroke, post-infectious brain injury, movement and exercise is one of the things universally seen in the research that, for example, concussions, we know it helps to improve recovery time. Okay, so the length of time someone suffers will go down. Now, I personally like using stationary bikes the most. The reason why is because if people have got back pain, neck pain, other things like that, it tends to be more gentle for them than other things. Also, it doesn't challenge weaknesses in their system, such as vision or vestibular, that are routinely impacted with injuries. So a lot of this depends on your prior level of function before you have this injury that's occurred and how long it's been since the injury. But for many of my patients, I'll have them do the exercise bike, stationary, recumbent, okay, 3 to 5 minutes, 5 times a day. And you may be saying, well, can't I just do it 15 minutes and be done? Well, the thing is, you don't want to use all your energy in one place. It's better to do 3 to 5 minutes, take a break for an hour or two, get back on there and space it out like that. Now, as you can tolerate that over about a 3 to 5 day window, then you can go from 3 to 5, 5 to 7, 7 to 10, 10 to 15, and you can increase what you're doing. Now, as you increase, you only want to increase one of two factors at a time: how long you're doing it or the intensity. Do not increase both at the same time. And the reason why is because if you increase both and you notice an increase of symptoms that doesn't go down in an appropriate period of time, so it's still there a few hours later, we don't know which one was responsible for it. Was it because you just were on it longer, or is it because you were more intense? Now, you can have a little bit of an increase of symptoms. That is considered okay. So for example, if your headache goes from a 3 to a 4, that's considered okay. If it goes from a 3 to a 6, that is not okay. You need to automatically stop. That is too big of an increase, and even 3 to 5 is probably too big. Now, at 3 to 4, you want to time how long does it take for it to return back to normal. If it stays elevated for a period of time, that means you still did too much. But those are places to start. Then you have stationary, you have ellipticals. Once again, I don't like doing ellipticals till people's vestibular system and oculomotor system are back on track. Walking and other things can also be very helpful. And then if you've got bad joints, even water aerobics can be very beneficial as well. So I hope you found this information useful. Please check out the other videos on this brain injury recovery guide. And until next time, this is Dr. Z.